There we go. All right. So right here after 5 o'clock, we're going to go ahead and get started, everybody. I just want to thank everyone for joining us here tonight, for the Patient Partner webinar series. And today's topic, we're on what you really need to know about bariatric surgery. My name is Patrick Frank, and I'm one of the co-founders here at Patient Partner. And during today's series, we are super excited to be hosting Dr. Michael Russo of Smart Dimensions weight loss surgery practice in Orange County. And he'll really be discussing the stigma behind obesity, weight loss surgery, and how to overcome it. And he's really going to be explaining, why you might be eligible for the surgery, the effectiveness of it, and really the insurance accessibility of the surgery as well. And, we also want to welcome Dr. Russo's recovered patient, Dina, who's going to be sharing her story on fighting obesity and finally committing to a sleeve gastrectomy surgery in which she lost 122 pounds. But, before I officially introduce them, I want to tell you a little bit more about exactly what Patient Partner is and why we started this company. And to start off, is just Patient Partner is really a community and a platform that has been built for patients by patients with the sole mission of giving back all through relatable experiences. We provide the opportunity for patients to connect one-to-one with one another and learn more about what the surgical journey is like and what to expect, before even going into surgery and what happens afterwards. A question we get all the time is, what is a patient partner? And very simply put, they're just like you and me, except for they've been through one of these surgeries, right? They've been through the surgery that you are exploring. And, they're 100% volunteers who are donating their time to share their experience, and they're there to answer the questions that you have that are really creating, this uneasiness, at this very important time in your life. And our goal is to really guide you through that surgical journey and make this process easier for you and your family. And whether it's finding a surgeon in your area, checking your insurance coverage, or just pairing you up with one of our patient partners, we're here to help you. And, I really want to, kind of transition into introducing the folks who have really joined us on the webinar. And the first of those is Dr. Michael Russo. And he is truly a bariatric specialist located in Orange County. He has over 13 years in the medical field. And as a board certified and fellowship trained bariatric surgeon, he specializes in minimally invasive and robotic techniques that provide his patients with the best possible results. And we're really going to be covering, the following: what obesity actually is and how to deal with it, the safety and effectiveness of bariatric surgery, and the insurance requirements on how you can get your surgery covered. And on the very end of this, we're going to be, telling that personal story from a past patient and telling you exactly what she went through. And then we're going to open the floor up to her and let her talk about the experience. And we're going to leave 10 to 15 minutes at the very end to answer some of the additional questions that you guys have provided to us when you signed up for the webinar. So, with that, I kind of want to take a step back, hand off the mic. And I want to hand it off to Dr. Russo to allow him to get started. And Dr. Russo, thank you so much for joining us. It's such an awesome pleasure to have you here.
I'm happy to be here, Patrick. I appreciate it very much.
Awesome.
So, as Patrick stated, I'm a bariatric surgeon. Thank you all for joining us today, and I hope that you learned something today and have a wonderful experience. I'd like to start by truly helping people understand the disease of obesity. It's important to understand first that it's a disease. Medicare has categorized it as a disease, and because of that, it needs treatment. The treatment for obesity is not just not eating as much. The treatment is a medical treatment, specifically bariatric surgery. And because of the pandemic of obesity, it's become a worldwide health concern. Some of the countries that are plagued most impressively by obesity are actually in the Middle East. It's really scary how important the the control of obesity has become, just because it's become so prevalent. There are countries now that are approaching a 50% incidence of obesity in the Middle East. But you need to understand where it comes from. And it's not your fault. This is a condition that is caused by a combination of genetic and environmental factors. So you need to first understand that you were given this, you were dealt this deck of cards, and that's not your fault. It's been passed down through your family. And what those genetics are is a predisposition for your body's weight set point, which is like an internal thermostat, to be affected by a Western diet, which is one that's high in processed and refined carbohydrates as well as liquid sugars. For some individuals, when they're exposed to that type of food, it alters their body's thermostat. So as you consume this type of food, your thermostat gets turned up, which is why when people have tried medically supervised diets, even with medication, even with a doctor's help, they find themselves fighting their body. Their body doesn't want to lose weight. And that's because of the hormonal effect. So these hormones that are secreted control how hungry you feel, how full you are after a meal. And frankly, they are the reason why people have this problem with called yo-yoing, or when you try to lose weight with a diet, even with medication, you may start losing weight from your weight set point, but it's a bit like stretching a rubber band. You'll notice that your body starts resisting you more and more and more. And then what happens when you come off that diet? Well, you spring right back up to that same weight. That's your hormones at play. And it's important to understand that because obesity necessitates a hormonal treatment. Just dieting is not going to do it. And we'll talk a little bit more about your likelihood of success with diet and exercise alone. But I want to encourage you to seek out treatment. Why? Because bariatric surgery is extremely effective. It works. You need to understand that. Not only that, obesity is not your fault. This is a consequence of a combination of factors that have caused your body to be dysfunctional. It's out of control. So gone are the days of a doctor telling you you're obese because you eat too much. So stop eating and you'll lose weight. There is nothing more wrong than that. And with this slide, it illustrates just how impactful this hormonal dysregulation is. Instead of obesity being the catalyst for these medical problems that you see listed here, I want you to think of the hormonal and metabolic problems that you develop as the source. This is something called metabolic syndrome. So if you were to think of a tree, the trunk of the tree is this hormonal and metabolic dysregulation. One of the branches or consequences of this hormonal and metabolic dysregulation is obesity. Another one, high blood pressure, sleep apnea, diabetes. It literally affects every organ system in the body. So the way to treat this is by a hormonal change. What we do is we don't just trim the branches on that tree, we cut it down at its trunk. And that's why bariatric surgery is so effective at not only weight loss, but correcting a lot of these medical problems that accompany weight loss and lead to an early death. Can we go to the next slide, please? So with the understanding of where obesity comes from, the next step is to understand the treatment. And there are many people that have explored the different options available with bariatric surgery. Typically, people think of bariatric surgery as something that usually sprung up around the late 80s, early 90s. People would think about the gastric bypass when it was being done then. And many people consider bariatric surgery to be dangerous. And the reason is because of a preconceived notion from those times. Back in the day, when bariatric surgery was first being done, it was done with a big open incision. It was done on patients that were so sick, they were literally dying from obesity. And at that time, the mortality rate was 10%. So it was dangerous. I mean, That's where that preconceived notion came from. But it's very important to understand that that's a different generation than what we do today. Now we do all of our surgeries through tiny little buttonhole incisions where you have multiple small buttonhole incisions, and we keep our hands outside of your body, and you recover really well from this. Not only that, bariatric surgeons like myself are specifically trained and very, very extensively trained in how to minimize the risk associated with those that carry excess weight. It's important to know now that bariatric surgery, like it said on that last slide, specifically the sleeve gastrectomy, is 5 times safer from consideration of serious complication or death than getting your gallbladder removed. That's the single most common surgery, and most people think of that as routine surgery. So this really is safe surgery. So when you're really trying to weigh the risks and benefits, you need to understand that the overall risk associated with surgery is very, very small, and the overall benefit to your life is extremely great. And that leads into my next point. The reason why we do bariatric surgery. Yes, I want you to not weigh as much. Yes, I don't want you to have these problems with high blood pressure and diabetes. But really what I want to do is help you lead a longer and higher quality life. Yes, the surgery is extremely effective. About 90% of patients are what we call successful during the first year, or losing greater than 50% of their excess body weight. On average, patients that get a sleeve or a bypass lose about 80% of the excess weight they carry. It's very, very dramatic. And overall, it resolves their medical problems very frequently, like high blood pressure, sleep apnea, diabetes. They all just go away, or they become much more easy for your other doctors to manage. Interestingly enough, with those improvements in the hormonal aspects of obesity and metabolic syndrome, we're not only going to improve the quality of your life, like I talked about, but you'll lead a longer life. Why? Because you won't have these problems like heart disease, stroke, and early death. So this will extend your life on average by 8 years. And what I like to talk to patients about here is, yes, we extend your life 8 years, which is fantastic. But what is the value of 8 years if it's not of high quality? The more important aspect in this is that we not only extend your life, but it's a higher quality life where you don't have to feel like you're a prisoner in your own body and you recognize the person looking back at you in the mirror. That's why we do what we do. And I consider myself one of the most lucky individuals in the world to be given the privilege to be able to give patients this tool. But ultimately, it's up to you. And Dina is going to talk to you a little bit about that. A lot of people ask about insurance and how do I get my insurance to cover it? Does my insurance cover it? And the first real categorization to answer that question is, how heavy are you? What's your BMI? So typical insurance requirements are that your BMI needs to be 35 or greater with the presence of an obesity-related medical condition like high blood pressure, diabetes, sleep apnea. Or if you have a BMI of 40 or greater without those medical problems, you'll qualify. Insurance companies are very commonly covering obesity surgery or bariatric surgery. So it's likely you do have coverage with your insurance policy. If you do lose weight during a preoperative diet requirement, you still do qualify for weight loss surgery as well. Okay. And it is okay even if you haven't lost weight with medically supervised dieting or previous diets in the past. Insurance companies do not require that you lose weight in order to qualify. What insurance companies ask typically are that you undergo a specific medically supervised diet period. Most insurance companies have a medically supervised diet period, and that can range from 0 to 6 months. It's very common for insurance companies to require 3, 4, 6 months of medically supervised diet. And if you go to a comprehensive center, typically like a practice like mine has a dietitian that gives those dietary classes. So this is something that you just get plugged into in order to fulfill those preoperative requirements. Additionally, insurance companies typically require a psychological evaluation to make sure that you don't suffer from any eating disorders and that you understand the lifestyle changes required in bariatric surgery, as well as a clearance letter from your primary care provider to say that you're of acceptable risk to undergo bariatric surgery. Like I said before, most insurances do cover bariatric surgery, so please reach out to your friendly neighborhood bariatric surgeon. I'm located in Los Angeles and Orange County, and typically we could just get you verified, confirm that you are covered. And the fact is even if you aren't covered, there are a lot of patients that still get bariatric surgery, even without insurance coverage. So self-pay is a great option. There's been a lot of great data to suggest a benefit for patients to get bariatric surgery if they have a BMI of 30 and up, especially if they have an obesity-related medical condition. So for those patients that maybe don't quite meet insurance requirements, or they have some sort of a bariatric surgery carve out, or don't have a bariatric policy on their insurance, which is rare, self-pay can be a great option for patients as well. It's important to also know that Medicare and Medicaid do typically cover weight loss surgery in accordance with the requirements that I mentioned earlier.
Perfect. And thank you so much, Dr. Russo. I mean, that is like, it's such an awesome overview of the entire surgery. I remember, you know, when we first sat down with you and you talked with us and you really walked us through, you know, all of these unknowns that I feel like so many people have. And it's one of those things where, you know, I'm still shocked every day about how much I'm learning about the benefits, you know, of this surgery. And having someone like you to join us and be able to explain it in such a great way and in such a, you know, well-spoken way is just really something special for us and everyone here. Now, you know, I do, you know, it's kind of the next step of being able to pass the mic off to Dina, and Dina is one of our really truly valued patient partners here. And she is one of those individuals who is, you know, spending, you know, volunteering her time to help others, you know, learn about this surgery, learn about the process, learn what life is like after surgery. And I can tell you guys, you know, she is such an amazing woman, and we are super excited to have her here and be able to really tell us about her experience and what drove her to get the surgery and how today she's feeling about the surgery. So I'll stop talking again too much. And Dina, please, please introduce yourself. We're so excited to have you here.
Well, thank you. It's a pleasure of mine to be here and to help out. I'm so grateful for a lot of people's support over the years, not the least of which is Dr. Russo and his team. So to be able to help somebody else, you know, be able to achieve what I've achieved would be awesome. So that picture is from a trip in Alaska after I had lost all of my excess body weight and just out there having a blast. So that's a fun picture that you chose. So I did lose 100% of my excess body weight, as it says on there. And I'm a size 4. I've been a size 4 now for several years and have been able to stay right around the 138 mark. And I did have a sleeve gastrectomy. I was always chunky as a kid. I was always wearing larger sizes than my peers. And that hereditary factor was definitely part of the issue. My mother's overweight, her mother was overweight, her mother was overweight. I actually knew my great-grandmother. She passed away when I was in my early 20s. So, you know, I saw it around me. And I eventually figured out that I didn't want to be that way, but it took a while to get there. So clearly, the people around me were teaching me these eating habits that ended up helping me gain all this weight. And then at 20 years old, I am pregnant with triplets. Yay. But it was off to the races after that regarding my weight. Basically, I rarely saw under 200 pounds after that until I ended up meeting Dr. Russo. But before that, you know, it's hard. It's hard when you're carrying around that much weight. You're taking care of 3 kids. I eventually had another child about 4.5 years after that. So I have 4 total. They're all in their 20s now. And I was able to raise healthy sized kids. I have 3 daughters and a son. My daughters, and I'll just talk about them because I'm female, they are either a size 2 or a size 4. And I just told you I'm now a size 4 and have been for some time. So I knew what to do. I knew how to raise my kids to not repeat this mistake. But like Dr. Russo said, my thermostat was already jacked up. And it didn't matter how much dieting and exercise and all of those things that I tried. It didn't matter how many of those things I did, I still yo-yo. Yes, I'd lose weight, but then I'd gain it back and then some. The picture that you're looking at on the left right now was at my heaviest. I was over 260 at that point. The picture on the right was me this past September in that dress. So that's pretty awesome. But at that heaviest, I can recall going on a trip to the Grand Canyon with my husband and kids. And if you've ever been to the Grand Canyon, to get up to the rim, you have to go from the parking area and climb these stairs. And I cannot tell you, I thought I was going to die before I got to the top of the stairs. And then it was just like, oh, can we just sit here for a minute so that I can catch my breath? It's really hard, not being able to keep up with my husband and my kids because of my weight. And, just like, oh, I can't breathe, my chest hurts. So when I had investigated bariatric surgery, I kind of thought it was for the rich and famous initially. And everything that I was learning about was about the bypass procedure. And for me, it just wasn't the right procedure for me. I knew that I wasn't willing to commit to the program that went along with that. And to be honest, I kind of felt a little guilty, like I was cheating. And so I very fortunately came to cross paths with Dr. Russo because of my work. And it was part of that I learned about the different options available in bariatric surgery. And I had been approved 2 times before meeting Dr. Russo to do bariatric surgery. And I wasn't comfortable with the doctors or the practice and the procedure, and nobody ever said, oh, we have this gastric sleeve procedure. And so meeting Dr. Russo, learning more about his staff, was really an important part of the process that allowed me to move forward and have this procedure done. And in case anybody's wondering, it was the best decision of my life. And I've told Dr. Russo, I wish I had met him at least 5 years earlier, at least. So it's absolutely life-changing in so many ways. If you've been heavy, that, people look at you differently. I just put up a picture of me post-surgery and after losing all that weight. And that was the first bikini I had ever purchased in my adult life. And I was in my late 40s there, ever. And, proud to be able to wear it and feel good about it and not feel like, oh, they're looking at me and what are they thinking? And so whether I'm in a bikini or I'm in a work dress like I am today, I feel so much more confident and can just be me and feel normal. Whereas before I'd be thinking about, you're looking at me and what are you thinking about, in that regard. So I want to talk a little bit about the surgery itself and post-surgery recovery. I know some people have some questions around that. I found that the procedure was easy, if you will. The worst part of it was having to do the liquid diet ahead of time and then the liquid diet afterwards. I remember negotiating with Dr. Russo afterwards about when I could go and get a poke bowl and have ground up tuna instead of liquid because I was over that. So that was a conversation. But the most important thing really is to follow the program, do what you're told. I had 4 incision sites. I can't find the scars anymore. They were so small and they've now healed. I did spend one night in the hospital, and that was a requirement of my insurance program. So not everybody has that requirement. And I know looking back on it, I could have done it as an outpatient, and I know that that's something that is done. I only had pain meds in the hospital, and so by the time I got home the following day, I didn't. Dr. Russo told me to walk because that's really important to get up and get moving. So I walked my dog, and I messaged him and said, hey, I was walking my dog. Here's a picture. Now, the funny part is I don't just have a dog. I have a 150-pound Alaskan Malamute. So Dr. Russo was in a panic about that, but it was all good. Nothing bad happened. So, you know, some of the hardest things really were about the diet, yeah, especially the liquid diet, and getting used to the diet and like, oh, I can only eat that much. And if I eat more, like I'm going to feel like I'll be ill. It wasn't common for me to eat more than I was supposed to and throw up or things like that. I think in the very beginning, maybe once or twice, I wasn't quite used to how this all works and overdo it, but you learn quickly. You learn quickly not to do things that are going to make you not feel good. So overall, I think that my experience with surgery was not difficult, and it just motivated me and set me on this journey to do what I needed to do to have a different quality of life than I had been living. You know, people would ask me, so what's your goal weight and how much have you lost so far? And I'm like, I don't know. I don't really have a goal. You know, for me, it was about just taking it one day at a time, being grateful one day at a time that I was less heavy than I was yesterday, and that I was on this path and had this support, and to just follow the program. And I figured everything else would take care of itself. It was really impactful to me, Dr. Russo's conversation around your internal thermostat and how this process would give my body an opportunity to reset that thermostat. So I was just focused on using the time of recovery and that first year post-surgery to reset my thermostat, and figured it's going to land where it's going to land, and I'm going to be grateful wherever that is, whether it's a size 4 or a size 10 or size 16, to be honest with you, because it was way better than being a 26. So at 6 months, I had reached 80%, and I love sharing this story. Dr. Russo and I were at an event, and it was at my 6-month mark, and I was like, oh, I've lost 80% of my excess body weight. And I was like, oh, that's really good. I go, but I'm going to lose 100%. And he just laughed at me. I go, it's not up to you. It's up to me now. You know, I remember when we went into the operating room, because he comes and sees you before you go into the OR, and he said, all right, let's go get your tool. And, you know, I remember it now, you know, 4 years later it's been, and I remember that statement more than anything else. You know, it's not cheating. It's just giving me a tool that I didn't have before. And then it became up to me to use that tool to get where I needed to go. So in closing, I just want to let you know that it's really opened the world up to me. My last story to share with you, Dr. Russo mentioned about life expectancy and quality of life. So when I was in my early 30s, I tried to get life insurance, and I was pretty much denied and put in the D category. And if I was going to buy it, it was going to be crazy expensive. Okay, well, fast forward now, some 15 years older, and I just went through the process of getting life insurance, and they came back and said, well, you rated in our top tier, and we'd like to offer you longer term and more face value because you're so healthy. And like, this doesn't happen in the age of COVID. And so, you know, it's just a funny story to have gone from younger and not in a good place health-wise, and now to be here 15 or so years later and to be so healthy as to have that happen. So I share that with you just to tell you just how much it changes the quality of your life and changes the quality of your health.
That is awesome, Dina. I mean, again, you know, I know for everyone here, this is the first time hearing Dina's story. And, here at Patient Partner, we have heard her story, but every day that we hear it, that it is so inspiring, right? I mean, I think there's such few people that, really are able to really share with that level of, depth and like really sincerity around, it's a very emotional experience, right? And it takes someone like, just like you, to be able to like stand up and be able to like give that back to others. And so I really want to thank you, for being able to do that and partnering with us here at Patient Partner. And Dr. Russo as well, you guys. I mean, it's a wealth of information from two very different perspectives, and that's what we're all about. And I know I wanted to give a little bit of time here at the very end for some Q&A. As I mentioned earlier, there are folks who, when they're registering for the webinar, we were asking questions, hey, what are the questions that you have? And so we chose the ones that actually, there were several repeats, submitted. So we chose the ones that we saw most frequented. And so I think we'll want to start with Dr. Russo and have you answer these first couple. And then Dina, we have a couple for you as well. And yeah, so Dr. Russo, I'll kind of hand the mic back off to you.
Okay, thank you. And you know what? I mean, I've heard Dina's story countless times too. And gosh, I'm just so proud of her. And that's what I do as a surgeon. My job is I give people a tool and I educate, and then watching people just run with the torch like that, there's nothing that brings me more satisfaction than that. But I digress. What are the biggest risks? So I get asked this a lot, actually. Main risks, and you may remember Dina talking about walking a lot afterwards. One of the main risks is blood clots. So the way to prevent that is to be up walking after the operation. In fact, as soon as you're awake after the operation, my nurses are instructed to get my patients up moving, get that blood flowing in the legs and in the hip region, because that's where the blood clots form. So that's a really important aspect of your recovery process. The best way to get the process started, it's to reach out to your friendly neighborhood bariatric surgeon. Like I said, I'm located in LA and Orange County. You could just go to our website, fill out an insurance check. Most bariatric surgeons have some sort of a starting point, whether it's a free consultation or a free informational seminar. Start there. And if you don't know where to go, speak to your primary care provider about your desire to seek out weight loss surgery or even some treatment to help with your weight. I'm a bariatric surgeon. Yes, I do bariatric surgery, but as a comprehensive weight loss center, we do everything under the sun. So maybe bariatric surgery isn't the exact right step for you. And you know what? Ask your primary care provider or seek out someone with the expertise to be able to fit you with the tool that best fits your needs. And that leads into the next question. What surgery is right for me? Answer is, it depends. If you do qualify for bariatric surgery, that means that likely bariatric surgery is the right choice for you. Typically speaking, it's a sleeve gastrectomy. That's about 75% of what we do. Sometimes it's called the gastric sleeve or just the sleeve. Very, very well tolerated, very safe, very, very excellent weight loss results. So that's typically the right choice for most. If you do have severe diabetes or severe acid reflux, the gastric bypass may be a better choice for you. That is a little bit of a deeper dive. It's what I call a higher maintenance operation, but it's still very safe. It's on par with getting your gallbladder removed. Does Medicaid or Medicare cover the procedure? Yes. So if you do have Medicaid or Medicare, that is okay. In California, it's Medi-Cal. Medi-Cal covers it. So find your neighborhood bariatric surgeon, reach out through Patient Partner, find an affiliated surgeon, and get your surgery today.
Amazing, amazing. Again, your ability to run through questions like this in such a clear, simple manner speaks exactly to your expertise. And so we're gonna kind of, I think we have one. Yep, we have another couple questions here. And Dina, I believe these ones are for you.
Awesome. So how long is the recovery process? I like to share stories when I talk about this. And Dr. Russo suggested that I be off for 3 weeks. And I'm like, you've got to be kidding me. You know where I work. That's not going to happen. And he sits down and he puts his head in his hands and he shakes his head and he goes, I knew this was going to be a negotiation. So I agreed to be off for a week. In reality, I had the surgery on Monday. I was home Tuesday morning, walking the dog. And by Friday, I went to the office because I was bored and feeling good. Overall, I would say, though, that there was a recovery period that felt more like 3 to 4 weeks, but it wasn't like I felt bad or I couldn't do things. I just felt like maybe I needed to take it a little bit easier than I might otherwise do. But overall, it was generally a quick and relatively easy recovery process for me. The advice to avoid regaining the weight is to follow the rules. There's no trick. There's no magic. There's nothing special to learn. There's nothing special to do. Just follow the rules. When he says don't use straws, don't use straws. When he says don't eat rice and pasta and bread, don't eat those things. Learn to do veggie noodles. Learn to do lean proteins and I eat way more seafood now than I ever did. So I eat a lot of fish and shellfish, things like that. So making good choices with your food is really important. I think Dr. Russo has told me, it's about 90% diet. So staying on point with your diet, which you will do for hopefully the first year for sure, really sets you up to build good habits. The next one's so funny. Do I have any regrets about going through surgery? My regret, as I said earlier, was that I didn't meet Dr. Russo earlier and learn about this procedure and have it done earlier, because it would have changed my life sooner. And who knows the world of possibilities that would have opened up. I have absolutely zero regrets about doing the surgery. And then what is the diet like after? Well, I talked a little bit about that. I mean, immediately after, it is an all liquid diet, and I'm not a huge fan of protein drinks to begin with. So that was a little challenging because you really have to get your protein in. The nutritionist will give you guidelines about what level of protein you need. And if you're male or female, that will affect the amount of protein that you should be taking in each day. The other thing that was really impactful for me with the nutritionist at Dr. Russo's office was about it becomes not about the quantity of food, it becomes about the quality of food. So yes, I spend less at the grocery store. I also shop the perimeter of the grocery store. It's rare for me to go down the aisles unless I need spices or water or something like that. But basically, I'm in produce, I'm in dairy, and I'm in meat, and that's pretty much the end of it. I totally lost my train of thought. I'm so sorry. So yeah, it becomes just about eating quality items. I remember. So if pre-surgery, you were used to going to McDonald's and getting like 2 Big Macs and fries, going now and only having half a Big Mac and half the fries is not changing your diet. That's not going to work, and you are not going to get the value out of the tool that you work so hard to get the tool. So the diet does become really important, and it's all about quality and not quantity.
That's awesome. And again, I think that, you've kind of like, even when sharing your experience with all of us, it's kind of like you hit almost every single one of these, and to be able to go and dive in with a little bit even further detail, I think that's what it's all about. And I mean, when we set off at the beginning of this webinar, right, we had this mission and really the goal of showcasing, right, like how weight loss surgery can really change one's life. And hopefully we've done that today with all of our listeners. And I want to thank everybody here, that joined us. And I really want to thank, Dr. Russo and Dina for being such great resources for us, not just today on the webinar, but every single day, and being a part of this platform and community that we are creating here at Patientpartner, and spending this time with our audience. I really want to, thank you guys for that. Yeah, of course, guys. And I just wanted to remind everybody one more time that this webinar is being recorded and that a copy is going to be sent directly to the email that you signed up with. And if you guys are wanting more information at the end of this webinar, or if there wasn't a question that you guys had answered that that you have burning, we really want to connect with you guys. You can contact us directly at info@patientpartner.com, or go to patientpartner.com and be able to contact us directly then. And so, any feedback on the webinar for us would be extremely helpful for our team as we continue to produce these series and really make them better for each and every single one of you guys. So we want to thank again everyone who joined us today. And I really hope to be doing more of these in the future. And we look forward to really being a part of your surgical journey and be there to answer anything that you guys have at the top of your mind. Because we know that when going through surgery, you need more than just the information, guys. You need a partner, and that's why we're here. So thank you so much, everybody. It's been such a pleasure hosting everybody. And we look forward to seeing you guys soon.